Hey y'all, one of the biggest lead measures for combating complacency, or perhaps to let things backslide in your clinical work, is to always make sure that your treatment plans are matching the standard of care. And so, we all have a standard of care that we've gone over and we've talked about. It's written, it's defined. Certainly, I always welcome feedback on that. I hope we're all universal in adopting that standard of care. But the key is to make sure that, one, your treatment plans match that standard of care. So generally speaking, your ratio of foresurface fillings to crowns and buildups should be, like one foresurface filling for every 4 crowns that you do. There are times where a foresurface filling really makes sense, but if you're constantly finding yourself doing huge fillings and you find yourself maddened and being driven crazy by that, then maybe the answer is that there could be a little bit of approval addiction creeping in, and that you're not actually matching the standard of care to your treatment plan. So that's one example, is where you can make sure that 80% of the time you're doing crowns instead of big, huge fillings. The other examples would be to make sure that if a patient has mentioned that they would like whiter teeth, that you're not only just throwing your treatment plan should at least have whitening on it, but 2, maybe your treatment plan should be where you're saying, hey, tell me about your whiter teeth. Is there anything else about the shape, size, or color of your teeth that you're wanting to have evaluated? Is there any concern with your smile otherwise? Would you like to take some photos, maybe do a smile test drive, whatever, and we could make some recommendations for the best way to improve your smile. Certainly if the color of their teeth, they want to improve that, and we don't have any representation of any plan to do that, then it tells me that we're either not paying attention, or maybe we're letting approval addiction creep in and we're not planning towards the standard of care. Same things, patients checking that they have snoring. Are we making some sort of recommendation for looking at ortho, a sleep study, things like that? If they have signs of wear and tear and grinding and have fractions on their teeth, do we at least have an occlusal guard on there? If not additionally a plan to identify and diagnose where is that coming from, and could we stop them? Could their teeth be restored? Things like that. And so, on the smile front, if they have a lot of color changes they need to meet, maybe the answer isn't whitening, it might be veneers. You should at least ask them what they've tried before, because a lot of patients have tried things. So, your treatment plans should match and represent what patients are asking for in your practice, and certainly to the standard of care. Or if they have a partial, they have multiple edentulous sites, are they being given the option of implants? Are we recommending top level treatment in all cases? Are we treatment planning everything that needs to be done and recommending how to do it, and then figuring out how to make it fit into their lives? Just things like that. And so I hope this helps just to regroup a little bit as you go into the second half of the year, to make your treatment plans the best they can be and help alleviate some of the insanity that sometimes creeps in. Take care, guys.